Afternoon. Good afternoon, everybody, and thank you for continuing to tune in. I hope you all had a great weekend. Beautiful weather this weekend, so hopefully you had a chance to get out of the house and enjoy the weekend. Press conferences this week will be every day at 1, with the exception of Wednesday. It will be at 2:30. I know many of you tune in every day, so I wanted to give you a heads up. Wednesday will be at 2:30. As many of you are beginning to go back to work, which is a great thing. If you can't catch these on a daily basis and you want to sign up for daily email updates, you can do that at governor.ri.gov. I want to thank the members of the media and all the stations for continuing to air these. I very much appreciate it. And I hear from a lot of our doctors that they tune in on a regular basis in order to get information. So I want to thank you all for participating. My own view is from the beginning of this, we have said we're going to rely on facts. We were going to use the facts and information to keep ourselves healthy, safe, and informed. You're doing a great job at it, and I want to thank you all for continuing to do that. And staying informed is one way in order to keep us all calmer and safer. So we will begin, as we always do, with a picture of our data. As you can see from the data on the screen, it's a confidence-inspiring set of information today. We've seen a pretty significant decrease in our percent positive rate, even in the last few days. That is, to my mind, great news, because we've now been at phase 1 and a bit of a reopening for a few weeks, and we're not seeing an increase. We're seeing a continued decline, which is in percent positive, which is great. It's what we want to see. So, for example, on Saturday, we tested just about 4,000 people. So a record day of testing. We tested about 4,000 people, and we had a positivity rate of 2.5%. So just as a reminder for everybody, the CDC recommends that in order to think about reopening, you want to be below 10%. A month or so ago, we were in the high teens. A couple months ago, we were at 20%. The fact that we tested 4,000 people in one day on Saturday, and 2.5% of them were positive. Yesterday, we tested 2,000 people and had a positivity rate of 3%. So those are very encouraging statistics. I will say we're not there yet by any means. We still have certain communities which we are very focused on that still have percent positive rates that are too high. With the ones we keep talking about, Central Falls, Woonsocket, Pawtucket, parts of Providence, and Dr. Nicole Alexander-Scott to address that. But so not out of the woods. The virus is with us and will be with us until there is a cure or a vaccine. But if you just look at where we've been and where we are, and you look at the data on the screen, and you look at the fact that less than 5% of the thousands of people we've tested in the past few days are positive, that's very encouraging. And it should give you confidence that as today, when we begin our phase 2, we're going into phase 2 with confidence and with systems that are set up to keep us all safe. I would say, the systems are gonna save us. What do I mean by that? Wear your masks, keep 6 feet apart, do not leave your house if you're sick. If you feel sick, get tested, call your doctor. Continue to wash your hands. These are the things that we have learned really make a difference. And so I'm asking you to, at the same time we're reopening the economy, I'm asking you to double down and try even harder to follow the rules around social distancing and mask wearing and being compliant. As you see, though, with the 67 new cases and another 2 deaths, in a second, I'm going to go through what the weekend looked like and what phase 2 is going to look like. But I want everybody to take a second now to be mindful of the fact that we've lost over 700 Rhode Islanders already to this virus. Today, I'm reporting another 2 deaths. Struggles continue in our nursing homes and hospitals in certain of our communities, and we have to continue to stay vigilant and also just take a moment to be aware of the pain and suffering that is all around us in Rhode Island. The families who've lost a loved one and they weren't even able to say goodbye when they lost that loved one, the families who haven't seen their loved ones in nursing homes for months, the families who've been out of work for a couple of months. It is a very difficult time. None of that is lost on me, and I'm just asking everyone in Rhode Island, as I have, please be kind and empathetic and patient, and in any way that you can give a hand to somebody who you think is in need, do it. Do one kind thing for somebody today. It will make a difference, and it's what will get us through this. Back to the rules. I'm going to ask you to go sign up for your Crush COVID RI app. If you haven't, we're just over 41,000 downloads. It's great. We've gone from 0 to 41,000 in a couple of weeks. We got to get that up there. There's no reason not to do it. I mean, if there's no reason not to do it. Now, we have to do some work on the app to make it work on older phones. And of course, if you don't have a smartphone, there are exceptions. But if you have a smartphone and you use it, I'm asking you to go online, take 30 seconds, download the app, and give it a try. Also, I want to just remind you to keep up your contact tracing notebook. The app, if you do the location diary feature on the app, it'll keep track of where you've been, all the locations you've been to, but it won't keep track of the people you've been in contact with. So I'll be honest, I noticed myself getting sometimes a little lax. A couple days go by and I haven't written down who I've been with. So I'm talking to myself as much as I am to you. Grab the notebook, put it in a prominent place in your life, and take a couple of minutes at the end of the day to write down the people you were with. Okay, with all of that as preamble, today's a great day. It's an exciting day in that we are beginning phase 2. Phase 2 officially beginning today. There is going to be this week a lot of activity in Rhode Island that we haven't seen in months. Gyms are going to reopen, hair salons, barber shops, indoor dining will start back up today. All the state beaches are open for business. All the state parks are open for business. So there's a lot to look forward to. There's a lot to look forward to. And we've had a very good weekend. And I want to take a minute to go through that. The weather was great this weekend, which is the good news. And our state parks and beaches were the busiest been since we started this, even busier than Memorial Day. I would say generally, people did a good job. Not perfect, but people were doing a good job. And DEM did a very good job managing the parks and the beaches. A couple of parks were closed to visitors for periods of time. I think Cold State Park had to be closed, a couple other parks because they hit their capacity. I'm sorry if you were turned away. I'm sorry for that inconvenience, but we're really serious about keeping you safe. So by and large, folks were there. They were staying socially distanced, and we were able to keep the requisite number of people there and not go over the limits. Having said that, in Lincoln Woods and Colt State Park, we have to do a better job. We break up too many large congregations. So I just want to remind you, just because you're outdoors doesn't mean you're immune from the virus and doesn't mean you can't follow the rules. So if you went to the beach this weekend or you went to one of these parks, I'm happy you were able to enjoy it. But if you went there and started to find yourself, there were a few big congregations that we saw, some sports activities, contact sports activities between strange people who didn't come in their family unit. So we're going to ask you to maintain your social distancing and your mask wearing where you even at parks and beaches. Why? Because we don't want an outbreak. We don't want another outbreak. We're entering phase 2 now. I'd like to be able to enter phase 3 in July or end of June. means we have to follow the rules now. Business compliance. DBR, Department of Business Regulation, was out and about this weekend visiting a couple hundred businesses, and the overwhelming majority of reports were good. And the state police was popping in as well to different places. In general, they found more than 95% of customers were wearing masks, and nearly 100% of employees were wearing masks at the retail shops and restaurants where we were. That's amazing. That's amazing. It's what we want to see. It's what's going to keep us healthy. I'd like it to be 100%. You know, we want, if you are able to wear a mask, you know, if you have an underlying health condition, I understand that. If you're developmentally unable to keep a mask on, we understand that. But for the rest of us, there's no excuse. The fact that you don't feel like doing it, or it feels strange, or it's a little itchy, is not a reason not to wear your mask. If you're gonna go to the grocery store, if you're gonna go out for dinner, if you're gonna go to get your hair cut, gonna go wherever, I need you to wear your mask. I need you to not go if you're sick. I need you to wash your hands and stay 6 feet apart. The area that, like, hopefully we saw good compliance over the weekend. This is a good news story. This is me saying thank you to everybody in Rhode Island for following the rules and keeping all of Rhode Island safe. The one area that we need to do quite a bit better is that we need every single business that's opening to fill out their COVID control plans. This weekend, we only saw about 70% of businesses that were open had actually filled out their COVID control plans. The template is online at reopeningri.com. So if you're a business that's open, or planning to open, go to reopeningri.com. There's a template there. We're trying to help you as easy as possible. 70% is not okay. 100% of businesses that are open need to have a COVID control plan. The whole thing is, we've said, we're working for the best, but planning for the worst. The way you plan for an outbreak, the way you plan for something to go wrong, is you have that plan in place so we know what to do. So we, A, prevent an outbreak, and B, we know what to do if it happens. So please try a little harder. If you're a business, do your COVID control plan before you're, and if you're already open, and you're hearing me say this, and you're one of the 30% that hasn't done it, go today to reopeningri.com, get the template, and make it happen. This morning, Commerce did another Facebook Live related to this. We want to help you figure it out. I know this is new. Our approach isn't heavy-handed enforcement. Our approach is to help you get it right. So you can check out that Facebook Live. You can re-watch that. It might be helpful. And always call Commerce at 521-HELP. You could call Commerce, you could call the Department of Health, you could call the Department of Business Regulation, you could call the Chamber of Commerce, your trade association. We'll help you figure it out. What you do is not have a COVID plan. So take that seriously. This was also the first weekend that we had houses of worship open in any large scale for in-person services. I will say, as a person of faith, I can relate to the many of you who have said to me it's been very, very hard, physically separated from your faith community. And I want to thank you to our faith leaders who did reopen this weekend. By and large, we saw excellent compliance with the social distancing rules, with the mask wearing, screening folks before they entered the house of worship. We had a broad compliance, and I want to say thank you. I'll say, you know, my experience, my family and I were able to go yesterday to Mass, and there were very, very few people there. And it's clear that it's going to take folks a little while to get comfortable, but the parish did a terrific job. You know, everybody was screened to make sure they weren't sick. Everyone was given hand sanitizer before they went into the church, 6 feet apart, markings everywhere, priest wore a mask, folks left after communion. It was, I appreciate it. It's a lot of work for these faith leaders. They are working hard to keep you safe. And I heard that across the board. I want to say thank you. I will say this. Many houses of worship were closed over the weekend. I don't know if it was many or most, and it's okay. Because the truth is, as people start to realize all of the new process that you have to put in place to do this safely, many people are saying, hold on a minute, we're not ready. So that's fine. My message to you is take the time you need to put the measures in place before you reopen. And that's my message to businesses as well. All week long, we've heard from so many small businesses saying, I'm just not going to be ready for Monday today. Because people are saying, as I get into the details of how I'm going to have to work the flow in my business, there's no way I can be for Monday. So that's fine. It is much more important that you're ready than that you open today. And if you need us, call us, 521-HELP. We're talking to a lot of businesses, a lot of faith leaders. We want to be there to help you figure out how to do this. A lot of people have asked me, how many haircuts do you think will open this week? How many restaurants do you think will open? The answer is, I'm not sure the exact number, but it's a mixed bag. I think it's going to take a while before the majority of small businesses are back in business. This week, next week, it'll be a very big mix. Some are just going to stay closed. Others will go ahead and give it right. For those of us who are customers, be kind and patient. Like, it's going to be tough. It's the first time anyone's ever done it. So if you're going to go get your hair cut this week, just be a little bit more patient. And you're going to be asked to please wait in your car. You can't wait in the salon and read magazines. If you go to church or a synagogue or worship and it's different and there's not the music you like and you can't read from your hymnals, just please be patient. Please be kind and patient to one another. We're all going through it together. It's going to take a while before we figure this out. And all of these rules are designed to just keep us safe and healthy, and everyone safe and healthy. Today is a very big day for Rhode Island parents. Today is the first day that child care centers have been open since March. I'll say on a personal level, I have had to make many tough calls over the past few months. The decision to close child care centers and keep them closed this long is a tough one. It was a very difficult one for so many reasons. Parents can't work if their children can't be cared for. You can't go into the office if you don't have someone to take care of your child. We worried, of course, that the caretakers of children may be older family members, and we didn't want them exposed. But I made that decision. By and large, it has worked out well. And today, because we're in the place we're at, virus is in a better place, hospitalizations are stable, people are following the rules. Today, June 1st, we're reopening child care centers. I want to thank Care.com. Care.com came online early to partner with us to help connect families to babysitters. That service is still there, and I want to thank them for doing that for us. Having said that, I can practically hear the sigh of relief from the parents out there when I say child care centers are opening. Because although the babysitting options have been kind of the way we've gotten through it, it's been really tough, and I hear you, and that's why we're opening child care centers. Now, many parents are saying, but is it safe? So just bear with me for a minute. Our child care facilities and our Department of Human Services, led by Courtney Hawkins, have been working constantly for the past month and a half to make it so that we could open today and so that we could open safely. So first of all, thank you for your hard work. They have put in endless hours coming up with individual reopening plans. Every single child care center that is reopening today has had to produce and review detailed reopening plan so we can have confidence for your children's safety and for the workers safely. And they are all committed to keeping your kids and their employees safe. 4,000 staff at nearly 700 facilities participated in a DHS reopening webinar last month. So thousands of staff at hundreds of these centers, which are opening, have all gone through training on an individual basis. Almost 500 providers participated in collaborative sessions to come up with these reopening plans. In total, at this point in time, just about 600 provider plans have been approved, and they will be able to be going on. So that is a massive amount of work, and I want to thank everyone who has participated in it. And we are taking all the necessary precautions, temperature taking of the kids, mask wearing. We've been providing the surgical masks, extra cleaning, social distancing, pods that are consistent. You know, it is hard to get kids socially distanced, so we're, you know, realistic about this, but you can keep them in stable groups, different regimes around, or different systems around drop off and pickup. Childcare is going to look different, and I'm asking you please to be patient and to follow the new rules, but hundreds of childcare centers are opening today, and at your own pace, with your own comfort level. I'd encourage you to feel safe in letting your kids go back to these childcare centers. Another group that I want to thank, not related to childcare, but related to children, are the hardworking folks who've been working to provide school lunches for our kids. You know, there's a couple weeks of school left. Throughout this crisis, there have been so many unsung heroes, and I have tried at different points from the podium to give a shout out. Maybe it's the bus drivers at RIPTA, whoever, so many. Some we know, the doctors, the nurses, the nursing home workers, but then there are folks who have been working without a day off through their anxiety to keep Rhode Islanders safe and secure. And one group of those people are the workers who've been providing school lunches to our kids, very creatively. And so I want to thank you. On behalf of Rhode Island's children, I want to thank you and ask you to hang in there with us as we finish the year and go to the summer. I have two more quick notes. I want to take a second to address Rhode Island's LGBTQ community. Today, June 1st. June 1st marks the beginning of Pride Month in the month of June. The Rhode Island LGBTQ community, and family members and friends have, of course, made countless contributions to our state over the years. And this month, June, Pride Month, is a month for us to pause and recognize these contributions, and each of us to recommit ourselves to the values of freedom and equality. Now, typically, Pride Month is a month of great celebrations and gatherings. This year, obviously, the celebrations cannot and will not be the same. There cannot be large social gatherings, concerts, you know, big discussion groups. Obviously, we can't have a Pride parade or the day-long of events for the Pride Fest in Providence. But let's all still mark the month. So I can't wait to mark next year's Pride Parade. You know, Rhode Island has, I think, the best, if not one of the best Pride parades in the country, and we should be proud of it. Unfortunately, this year, I guess our celebrations will be a little more subdued, or at least socially distanced, but let's get creative and let's figure out our own ways to stand with our LGBTQ brothers and sisters, and also thank them for their contributions to the state. In the spirit of saying thank you, I want folks to know the support that community has lent in the past few months to our coronavirus effort. Rhode Island Pride has created a distribution network for coronavirus resources. Thank you for doing that. The Open Door Health Clinic has partnered to create coronavirus testing site in Providence. Thank you. It's fantastic. It's right in the community. And many other organizations have done really incredible work to provide critical supports, healthcare, food, social services, to LGBTQ youth through the past couple of months of the crisis. Later today, this afternoon, I'll be signing a proclamation, as I always do, to officially mark Pride Month. I look forward to doing that. And as I say, I look forward to marking the month in different creative socially distant ways, and next year to getting back out there to march. Finally, I want to take a moment to address the protests that happened in Providence over the weekend. There were, by our estimation, over 1,000 people here in Providence on Saturday. And I want to commend them for the fact that nearly all of them had on masks, were socially distanced, and very peaceful. It made me proud to be a Rhode Islander to see that. I will say, and I did a press event earlier today to talk more extensively on this issue. I will simply say now, there's a lot of very real, justified, valid, understandable anger and frustration that people are feeling now. And I would say that the COVID crisis has shed light on some of the inequities that have existed. And as as Dr. Alexander Scott and I have been out here day after day, we are deeply committed to equity and having an equity lens in the way that we meet the crisis. An equity lens to healthcare, testing, contact tracing, quarantining, food provision, housing. And I know we can always do better, but my commitment to that is only stronger today than it was a week ago. I will say, as I've said, to all the protesters who have been protesting throughout the COVID crisis for different causes, your firm right to peacefully protest is core to our American democracy. I'm asking you all to continue to wear masks, to be socially distant, to follow the rules, and to ensure that keeping yourselves and your family and our community safe. I'm not going to ask, I have not asked, throughout all of this, our entire approach through COVID has been to encourage voluntary compliance, to not be heavy-handed with our enforcement, and to allow people to come to compliance in a voluntary way. And I'm just going to continue to say that. And as I say, I was pleased on Saturday to see people were going out of their way to be many feet apart, holding their signs and wearing their masks. And so I want to thank you all for doing that. Now I will turn it over to Dr. Alexander Scott, and then we'll both come back for questions.
Thank you, Governor. Afternoon, everyone. As usual, thank you for being with us. We are entering phase 2, and it is an important time. We're able to do this because our COVID-19 numbers have been stable. And it's something that we will need to continue to follow. As the governor has said, we are not out of the woods yet, but we are moving in the right direction. And this is largely because of your patience, your cooperation, your decisions to prioritize health and well-being for yourself and your fellow Rhode Islanders. All of that has contributed to us being where we are. So thank you. I also want to recognize and thank the dozens and hundreds of people who are working behind the scenes as part of Rhode Island's COVID-19 response team. An incalculable amount of time went into preparing Rhode Island to confidently transition into phase 2. The people who put in those hours also deserve a huge thank you. To spend a few minutes on data, we have 67 new cases to report. On Saturday, we had 171 new cases, and we reported 106 cases on Sunday. There are 195 people with COVID-19 currently hospitalized in Rhode Island. This compares to the 219 and 206 numbers that we reported on Saturday and Sunday, respectively. We have 46 people currently in the intensive care unit, and 29 of those 40 people currently on a ventilator. Sadly, we have 2 additional COVID-19 associated fatalities to report today. One of these people was in their 70s, and one of them was in their 90s. Our prayers go out to the families of these 2 treasured Rhode Islanders. They also go out to the families of the 18 people whose passings we reported on Saturday, and the families of the 7 people whose passings we reported on Sunday. While every single loss is incredibly tragic, we hope to keep up this brief trend of reporting fatality numbers that are on the low side. Now to reflect on some of what the governor shared regarding equity. As we have said in the past, health equity is a major focus for the governor, for the Rhode Island Department of Health, and for all of our colleagues across state government. It is a major focus across the entire administration. While we can be encouraged that the percent positivity overall as state has trended in the direction that we want to, as the governor shared, we also have our eyes laser focused on those communities that still have the percent positivities that we want to address. The governor mentioned Central Falls, 26% positive. Providence, 24% positive. North Providence, 17% positive. Pawtucket, 16% positive. And Woonsocket, 15% positive out of all of those tested in the respective areas. These are numbers that we all agree are unacceptable, and while they are occurring in those communities, it's something that we all as Rhode Islanders have a responsibility to address. The governor and our entire team is laser focused, as I've mentioned, on being able to respond in an aggressive way, in a comprehensive way, in a thoughtful way to the communities that are experiencing these percent positivities. We have a team that's worked on this for weeks through the weekend. I was up reviewing through the night. We will be talking to the governor about this later this afternoon. We are committed to making sure that with whatever interventions we have in place, we want to take that impact to the next level, particularly in the communities that are disproportionately impacted. We know that that is going to have the benefit needed across all of Rhode Island. Our vision is that everyone has an equal opportunity to be healthy, no matter what their zip code is, no matter what their race is, no matter what their ethnicity is, sexual orientation, gender identity, level of education, level of income, or insurance status. We know also that data plays a huge role in our work to make that vision a reality. And teams of people work very hard to help that data inform the actual steps that we need to do. That's why we have worked with community partners to have healthcare providers and testing sites start gathering data across the board. We echo the value principle that we've learned with health equity zones. We need to make sure that the community's voice is at the forefront, and that's what we are responding to help address crises such as COVID-19 and the crises that communities face on an everyday basis. With June also being an acknowledgement of our LGBTQ community that we always want to uplift and prioritize, we are going to start gathering data on sexual orientation and gender identity. We know that that's going to be critical for us to continue to respond to every community that we uplift. This update of being able to gather data that we can now help inform our response with our LGBT community should be implemented shortly, and we're going to start working with hospitals and all other healthcare providers to start collecting these data for COVID-19 patients as well as we go forward. We're grateful to all who worked to make this happen, knowing how critical data is to help inform the work that we know we need to do. With that, I'm going to pass it back to the governor.
I heard from a dentist late last week. She's looking for clarity from the Department of Health. She's heard from the Rhode Island Dental Association, which has offered some suggestions on phases, but they don't quite coincide with the Department of Health. So where is it with dentists' office now?
We have been working very closely with our oral health community, recognizing the specific and unique elements that occur with that community. So we've supported them in being able to open in phases the way they need to. We've also worked with being able to provide the types of PPE that we have available that we can provide. So we'll continue to align the guidance that we have with what works best for our oral health and dental community going forward.
Her situation is PPE, and she said through the Dental Association, she got 10 large masks, 5 small ones, and 95s, and said that's a month's supply. At the beginning of the crisis, she donated 6,000 worth of masks, surgical gloves, grade disinfectant. Now she wants them back. So with all these resources that we have, her issue is PPE. She's an older dentist. She's been at it for 35 years. And quite frankly, she said if she can't open up by July 1st, she's going to close permanently. And there are other doctors, because they're on the front line, older and in that demo. So she wants to know what the state is in terms of these specific needs, PPE.
Yeah, PPE has been the number one need that we have discussions with our oral health community. Anything that we have access to that we can provide equitably across the board, we have been doing, particularly the surgical masks. It has been challenging from an accessing standpoint statewide, get some of the other elements. Gowns, as the governor has shared in the past, have been short. Being able to have N95s and face shields. It's something that we need to continue to work with the oral health community, helping them also in finding where we can get additional access to supplies. As we get it, once we have enough, we're sharing, but we recognize the challenge with the additional components of PPE.
Couldn't the state have seen this 2 months ago? Does the state not have enough now, or is there not enough being manufactured? Why is it not available?
We have had this as a priority since the beginning. There's a large group of providers within the healthcare industry that we're needing to respond to with some of those more medically advanced PPE components. So we have provided them to the oral surgeons and worked with practices that have been able to keep certain procedures for dentists available where patients need oral health. But the entire dental community makes it more challenging to be able to get of some of those more advanced medical supplies. But anything we have, we're getting to them across the board.
Governor, were you on this call with President Trump today where he's reported to have exhorted governors to get tougher with demonstrators?
I was, yes, I was on the call. In fact, yes, it was our weekly call.
What is your response to that?
You accurately summarized his comments. He urged us to be tough, and the word he continued to use over and over again was domination. He said the only way to deal with certain protesters is to dominate. So my reaction to that is, number one, I think we need to do, all of us need to do whatever we can to ratchet down the violence and to ratchet up our listening with empathy and sincerity. And so that's going to be my approach. Having said that, look, we're going to do what we need to do to keep Rhode Islanders safe. Thank God we haven't seen some of what you're seeing in other places around the country, looting, extreme violence, fires. We'll do what we need to do. I want Rhode Islanders to feel safe. We will protect our community. But I think overall, we need to all be asking ourselves, what can we do to play a peaceful role? And I find rhetoric, which is overly aggressive, is actually not that productive and incites more anger and violence.
Governor, you've sort of touched on this, but just to go back to it, do you believe that the COVID-19 crisis and the inequities that we've been able to see firsthand throughout this process are amongst the root causes of what we see with these demonstrations around the country? And is there a way to tie it all together, especially for folks right now who are, maybe their perception is that these events, the looting and so on and so forth, is coming from more of just a truly violent place and not from an expressive standpoint?
So look, this is complicated and you unpack a lot in what you say. So I'll try to answer it this way. Racism existed before COVID. It is ugly in all of its forms, and we all need to do more to stamp it out. Economic inequality, housing inequality, healthcare access inequality, education access inequality existed on the basis of race before COVID, and we all have to do more to bring about more equal society. Having said all of that, COVID has just exacerbated it in many ways. I mean, look, Dr. Nicole Alexander Scott just got up here and said, you know, where are we seeing 25% positive rates? It's in Central Falls. You know, the communities are poor communities have been disproportionately affected by this. People who don't have access to health insurance. Thankfully in Rhode Island, that's not that many people. But so anyway, I think it's just added fuel to the fire. I think the anger existed before and it's legitimate. I think it's getting worse now. And then when you overlay on top of that, people are out of work, stuck in their houses. That just adds a whole other layer, which is why my comment to Steve is we have to try to maintain peace and move to a more just place. But also you have to recognize there's a lot of angry people and it's hard to blame them.
Governor.
Was off topic. So Governor, are you open to having a guest speaker at some of these briefings, maybe 5 minutes or less? Somebody from a hospital setting, someone from the education world, a principal, a teacher, a superintendent, someone from a local bank, vice president, for people who wants to explain about a new initiative for something beneficial to Rhode Islanders financially. As if it's positive and can be very beneficial or helpful to Rhode Islanders, would you be open to 5 minutes or less to speak in the briefings?
Yeah, I think it's a good idea. We, now that we're entering into phase 2, we're generally thinking about the format of communication. So yeah, absolutely.
When people see the protest over the weekend here and, you know, a large crowd, but you said wearing masks and socially distancing, does it change your thinking at all? Or what do you say to people who are going to see that and say, okay, how come we can't have some other larger gatherings, especially later on in the summer if we're wearing masks and socially distant and one's okay and one's not?
Yeah. So let me say this, all large group gatherings are a problem as it relates to virus containment. That's a scientific fact. And the more large group gatherings that we have, where people are close together, particularly if they're indoors, we run the risk of that's creating more problems with the virus. And so that's why I said, as I've said to all the protesters over the past couple of months, yes, you have a right to protest, but I'm asking you to do it following the socially distanced rules, because if you don't, you're putting the health and safety of all the people of Rhode Island at risk. My approach the whole time, whether it's been beaches, graduations, protests, whatever, we put out the guidelines. We are here to tell you what we think are the best practices for keeping Rhode Islanders healthy and safe. And then I'm asking the people of Rhode Island to follow the rules. And that's the way it works for everybody.
I just follow, has there been any thought, I know Massachusetts has said later on in July, maybe in-person graduations could be held. Has there been any thought to kind of updating the guidance in Rhode Island? We have some questions about that.
Here's what I would say. The way we've done it is, we've put out guidelines, phase 1 and phase 2, and asked superintendents to work with their communities, to get creative and properly acknowledge the students who are graduating. So in phase 3, in July, hopefully, the social gathering limits will go up. There will be a greater relaxation. So if at that time a superintendent, decides they want to do something more within those guidelines, then they can do that. But I'm not going to tell them what to do. It's the same thing. We're going to tell them, these are the rules to follow if you want to keep your community safe. And then within that, the superintendents, principals, community kind of need to figure out how to do that.
Governor, I got an email over the weekend from a woman named Nancy in Warwick, in an assisted living center, not a nursing home, but assisted living. She said, I have been in my apartment since March 11th. And her argument, to summarize it, I guess, was that she feels that nursing homes and assisted living can be quite different. She said some of us have cars, we are still fairly independent, and yet we're kind of getting treated like these very frail patients. And is there any thought to, I guess, distinguishing at some point between the assisted living setting and the nursing home setting?
Yeah, we have been talking about this, and I'm going to let the doctor handle it.
We've recognized and understood the challenge, have felt the challenge of people not having the access to visitors or being able to get around to the extent that they would like to. What we want to do, particularly during this phase, is really be able to work in a more tailored way with facilities going forward to put together a plan, because individual facilities, nursing homes versus assisted living, will have different levels of capacity, different numbers of people to respond. So through phase 2, we want to keep it the way it is in terms of no visitation, but want to actively work towards what type of approach would work best. Similar to how the governor expressed it, our focus is recognizing the gradations of risk that occur. The older one is, the more likelihood that they have underlying illnesses, the more they are in a congregate setting, the higher the risk. As you walk back from that, you can still have the risk in people who are more independent and older. My own mother, in her early 80s, has also been in her home for several weeks, and we're figuring out creative ways to work through it. But as a retired director of nursing, she understands the importance of this approach in keeping her safe. And we'll work with Rhode Islanders to get to a point that we can continue to keep as many people healthy as possible and maintain their safety with that as well.
Governor, can I just, this morning, you referred yourself as a white woman of privilege. Now, you grew up in Smithfield, and you mentioned how your dad lost his job. You applied yourself, you went to LaSalle, got into Harvard, Rhodes Scholar, Yale. Don't you think by saying that, that minimizes the clear efforts that you put in, that your parents put into you to have you thrive academically,
Yeah. I don't. Look, you're right. My parents sacrificed enormously for my brother, my sister, and I to have these opportunities, and I worked my tail off my whole life. But I don't know what it's like because of the color of my skin to be afraid to walk into a convenience store at night. I don't know what that's like. I don't know what it's like to be just discriminated against and viewed differently just because of the color of my skin. And so while I can say racism exists, and I see it, and I work hard every day to do everything I can to deal with it and make Rhode Island a more fair place, I don't know what that's like. And I think that I just need to be honest about that. You know, I think of myself as not a person who's not prejudiced. I'm not. But I think we all need to get a little more honest and check our privilege and prejudice just to have an honest dialogue. So it doesn't take anything away from how hard I worked. Yeah, you're right. I wasn't born wealthy. I didn't have a lot of those advantages that a lot of other people did. But I've never been the victim of racism.
Just touch on how people listening now, the outbreaks in Providence, Central Falls, isn't that perhaps more just an element of a lot of people living congregated as opposed to, are we now to believe that the outbreaks of racism involved?
No. So let me thank you for saying that. You're exactly right. The reason the outbreaks are in these areas are multifaceted. You have immigrant populations who are afraid to come get tested, and that, you know, I get that. I'd be afraid too, maybe. You have people who are poor and they feel they can't afford to test it. You have people who fear losing their job if they get a day out of work, because if they have to take a day out of work. So that's related to poverty. And then you have exactly what you said, it's the density. The density is just horrible with this virus. That's why you look at places like Wyoming and Montana, it's so much easier to control the virus if you're a big rural place. So absolutely, if you have, I don't know, 8 people of multi-generations crammed into a small apartment with 1 bathroom, it's really hard to isolate and do infection control. So those are the reasons. All I'm saying is the facts are, if you look at who's being hardest hit, folks of color are being hardest hit.
So, given that today's the first day of the second phase, you figure it's going to be about 2 weeks before you know how well or poorly things are going to be going?
No, I think it'll be, closer to a month. I think it'll be closer to a month. I have said around July. My friend Brian always says, will it be July 1st? I say ish. We want 14 days to make some changes and about 14 days to observe them. So end of June, early July, assuming things still look the way they do. This is a big phase.
Are you worried all about the potential for outbreaks related to the gathering?
Yes.
On Friday, and there might be another one. I mean, is there any strategy in place, or is it just watch and see if those people start getting tested positive?
I'm worried about it. I'd be crazy not to be worried about it. Basically, I was just talking to John. I mean, we know this virus thrives when people get together in big groups. Thankfully, outdoors is much safer. So we are trying to come up with strategies, right? We're trying to come up, a strategy of having a heavy-handed enforcement approach to peaceful protests, I don't think is a good strategy, but maybe we are testing. Short answer is we're working on it. Testing, contact tracing, public health response to allow protest, but to do everything we can to make sure that there's not an outbreak.
Thank you, everyone.
Bye, guys.